We've finally reached the mucopolysaccharidoses, a group of disorders that involve deficiencies in the breakdown of glycosaminoglycans, or GAGs. Come join me at the Haunted Hotel as we learn about Hurler and Hunter syndrome. Hey, what was that? Did you smell something? Yeah, I'm sure it was probably nothing. Just my vivid imagination. Whew, keep it together, Ricky. I ain't afraid of no spectral figures. Okay, before we talk about these two diseases, a quick review on glycosaminoglycans, aka GAGs. GAGs are negatively charged complex carbohydrates that contain a repeating disaccharide unit. The main types of GAGs are heparan sulfate, dermatan sulfate, chondroitin sulfate, keratan sulfate, and hyaluronic acid. They're found everywhere in the body and bind to proteins, forming proteoglycans, a major component of the extracellular matrix in connective tissues. All right, enough with the nerd talk. Now we can go over the actual syndromes. And just a heads up, there are many types of mucopolysaccharide diseases, but we'll just be covering the two high-yield ones, Hurler and Hunter syndrome. We'll begin with Hurler syndrome, the most common mucopolysaccharidosis. This hotel guest hiding behind her door will remind you that Hurler syndrome is autosomal recessive. And it looks like someone had time to leave a warning message in all that slime. Do run, because Hurler syndrome is caused by a deficiency of alpha-L-iduronidase. Hey, he slimed me. That enzyme deficiency results in a buildup of those GAGs, specifically heparan sulfate and dermatan sulfate. Ew. I don't know what's worse, getting hurled by slime or rotten eggs. Actually, rotten eggs don't really sound that bad now that I think about it. So it's the accumulation of those GAGs that causes problems. Hurler syndrome is characterized by skeletal abnormalities due to abnormal deposition of GAGs in bones. Affected infants usually develop coarse facial features like a wide nasal bridge and flattened midface during the first year of life. In addition to short stature, they'll present with macrocephaly due to hyperostosis of the skull and hydrocephalus. Another characteristic finding is communicating or non-obstructive hydrocephalus due to GAGs depositing in the meninges of the spinal cord and preventing reabsorption of CSF. As you can probably guess, developmental delay and intellectual disability are not uncommon in these patients. GAGs can also deposit in the liver and spleen, causing hepatosplenomegaly. They can also deposit in the tonsils, adenoids, and possibly in tracheal cartilage to cause airway obstruction. Umbilical and inguinal hernias are also frequently present in these patients. Corneal clouding is a key distinguishing feature in Hurler syndrome. Remember that famous medical saying, you can't hunt if you can't see, but you don't need eyes to hurl, or, I don't know, something like that. Finally, there's a set of symptoms strongly associated with Hurler syndrome called dysostosis multiplex. This is characterized by the triad of hypoplasia of the anterosuperior portion of the lumbar spine, proximal pointing of the metacarpals, and expansion of the sella turcica. Unfortunately, these patients usually die from cardiac complications during early childhood. Okay, let's talk about our second mucopolysaccharide disease, Hunter syndrome. Who would you like to telephone? Ghost hunters! And that, my friends, is legally different enough. Hunter syndrome has some similarities to Hurler syndrome. It's considered a milder form of Hurler, and you'll also see elevation of the same substrates, heparan sulfate and dermatan sulfate. However, there are some key differences that you should definitely be aware of. First off, Hunter syndrome is X-linked recessive, and the deficient enzyme is iduronate 2 sulfatase. Notably, Hunter syndrome presents with aggressive behavior, illustrated by this aggressive-looking hunter. Finally, and perhaps most importantly on test day, corneal clouding is not usually seen in Hunter syndrome. Okay, let's quickly recap before those two cross streams and we all blink out of existence. Hurler and Hunter syndrome are mucopolysaccharidoses. Hurler syndrome is an autosomal recessive disorder caused by a deficiency of alpha-L-iduronidase leading to a buildup of heparan sulfate and dermatan sulfate. Hurler syndrome is characterized by the presence of coarse facial features, macrocephaly, short stature, communicating hydrocephalus, developmental delay, intellectual disability, hepatosplenomegaly, airway obstruction, umbilical or inguinal hernias, corneal clouding, and dysostosis multiplex. Cardiac complications are the most common reason for death in these patients. Hunter syndrome, on the other hand, is X-linked recessive and considered a mild form of Hurler syndrome. The affected enzyme is iduronate 2 sulfatase, leading to accumulation of the same substrates as seen in Hurler syndrome. The key distinguishing findings are aggressive behavior and lack of corneal clouding.